Hi, I'm Teresa Arrington, the Director of Quality and Performance Improvement at Ochsner Health System, which is a 48-hospital system out of the Gulf South with the flagship hospital in New Orleans, Louisiana. We serve about 1.7 million patients per year, and they come from varied demographic groups. Many of our patients do face upstream social determinants of health challenges, as well as serious conditions like diabetes and hypertension. For the last 2 years at Ochsner Health, we have been on a journey to reduce our AHRQ PSI3 events, which are severe pressure injuries in the adult population that are hospital acquired. It has been historically a very difficult challenge to get our arms around because pressure injuries can occur across many different patient groups. And at Ochsner Health, we run the gamut from academic medical centers to small critical access hospitals. So we needed to design solutions that would work across the board for different populations and areas with different resource constraints. PSI3s are a part of a number of different external reporting metrics, meaning that we are held to account for how we are performing with the measure. Internally, they are a part of our designed Target Zero program, which includes different HAIs, for example, along with never events like retained foreign objects or wrong site, wrong side surgeries. Most importantly, we want to improve here because this is a patient harm event that happens on our watch and under our roof, and we never want to see our patients suffer. We have pursued a multi-pronged approach, trying to find solutions within a framework that will work for our academic medical centers as well as our small rural hospitals. A few examples of some initiatives that we have piloted are support from virtual nursing, meaning that if a bedside nurse comes into a room that is wired with a camera, they're able to hit a button, and while verbally calling out what they are seeing on that patient's skin, a virtual nurse is listening in, creating all of that documentation in the note, and placing orders for the care that that patient might need. We have also developed and expanded an internal predictive model called our HAPI predictive model, or Hospital Acquired Pressure Injury Model. It is designed to identify patients who are at risk of developing a hospital-acquired pressure injury, and if that model crosses a certain risk threshold, an OPA will fire so that the staff know to place certain preventative orders so that that patient can avoid ever developing the pressure injury. We have seen a 50% reduction in those overall events year over year. This includes things like PSI3, retained foreign objects, and hospital-acquired infections. So the success at this scale is tremendous. In 2023, when we began the PSI3 focused work, we had 100 recorded events across our system for the year. We brought that down to 71 events in 2024, and year to date, as of October 2025, we have recorded 30 events across the system. PSI3 work can be quite overwhelming just by nature of the fact that it can occur on any population anywhere in the hospital. And so I think just starting small and starting somewhere with whatever you can do with the resources that you have available to you. Certainly technology and AI is coming a long way and moving into this space, but an old-fashioned eyes on the skin from a bedside nurse is a wonderful first step and something I would strongly encourage.